Understanding fibromyalgia, a complex chronic pain disorder. Fibromyalgia is a chronic disorder that causes widespread pain. This pain can be felt in muscles, ligaments, and tendons, often moving from one part of the body to another. The intensity of the pain can vary from day to day, making it unpredictable and challenging to manage. It also causes fatigue, sleep problems, and other issues. Many people with fibromyalgia report feeling exhausted even after a full night's sleep. This fatigue can be so severe that it interferes with daily activities and reduces overall productivity. It is important to understand fibromyalgia because it affects millions of people. This disorder does not discriminate. It can impact individuals of any age, gender, or background. However, it is more commonly diagnosed in women than in men. It can significantly impact a person's quality of life. The constant pain and fatigue can lead to emotional distress, including anxiety and depression. Social interactions and relationships may also suffer as a result. This essay aims to provide a comprehensive overview of fibromyalgia. We will delve into the various aspects of this condition to offer a clearer understanding of what it entails. We will explore its symptoms, causes, treatments, and tips for living well with the condition. Fibromyalgia is often misunderstood. It is frequently misdiagnosed. Many people go through years of suffering before receiving an accurate diagnosis. This is because its symptoms can mimic other conditions. For instance, the widespread pain and fatigue are also common in conditions like rheumatoid arthritis and chronic fatigue syndrome, making it difficult for healthcare providers to pinpoint fibromyalgia without thorough examination and testing. It is crucial to raise awareness and understanding of this complex disorder. By educating the public and healthcare professionals, we can improve the chances of early diagnosis and effective management. By doing so, we can help individuals with fibromyalgia receive timely and appropriate care. This can lead to better outcomes and an improved quality of life for those affected by this challenging condition. Unveiling the core symptoms, pain and fatigue. The hallmark symptom of fibromyalgia is widespread pain. This pain is often described as a deep, aching, and burning sensation. It can affect muscles, tendons, and joints throughout the body. The pain can fluctuate in intensity. It may be worse in the morning or after periods of inactivity. Fatigue is another prominent symptom of fibromyalgia. People with fibromyalgia often experience overwhelming tiredness. This fatigue is not relieved by rest. It can interfere with daily activities. It can make it challenging to fulfill work, social, and family obligations. Beyond the surface, exploring secondary symptoms. In addition to pain and fatigue, fibromyalgia can cause a wide range of secondary symptoms. These symptoms can be just as debilitating as the primary ones and can significantly impact a person's quality of life. These symptoms can vary from person to person. Some may experience severe headaches, while others might struggle with digestive issues or heightened sensitivity to stimuli like light and sound. They can contribute to the overall burden of the condition. The unpredictability of these symptoms can make it challenging for individuals to plan their daily activities and maintain a sense of normalcy. Sleep disturbances are common in fibromyalgia. Many individuals find it difficult to fall asleep or stay asleep throughout the night. Many individuals with fibromyalgia struggle with insomnia. This lack of restful sleep can exacerbate other symptoms, leading to a vicious cycle of discomfort and fatigue. They may wake up feeling unrefreshed. Despite spending enough time in bed, the quality of sleep is often poor, leaving them feeling drained and exhausted. They may also experience restless leg syndrome or other sleep disorders. These conditions can cause discomfort and an uncontrollable urge to move the legs, further disrupting sleep. Cognitive issues, often referred to as fibrofog, are another common secondary symptom. This can include problems with short-term memory, difficulty concentrating, and a general sense of mental cloudiness. People with fibromyalgia may experience problems with memory, concentration, and focus. This can make it hard to complete tasks, follow conversations, or remember important information. They may also find it difficult to find the right words during conversations. This can be frustrating and can affect their ability to communicate effectively with others, adding to the emotional strain of living with fibromyalgia. Unraveling the mystery potential causes of fibromyalgia. The exact causes of fibromyalgia are still unknown. However, researchers believe that a combination of factors may contribute to its development. These factors include genetics, infections, and physical or emotional trauma. Genetic predisposition is thought to play a role. Fibromyalgia tends to run in families. This suggests that certain genes may increase susceptibility to the disorder. Infections, such as viral illnesses, have also been linked to the onset of fibromyalgia in some cases. Physical or emotional trauma, such as a car accident or a significant life stressor, may trigger fibromyalgia symptoms. Section 5. The path to diagnosis. Criteria and tests. Diagnosing fibromyalgia can be challenging. This condition is often misunderstood and misdiagnosed because its symptoms overlap with many other disorders. Patients often experience a long journey of consultations and tests before receiving a definitive diagnosis. There is no single test to confirm the diagnosis. Unlike some conditions that can be identified through a specific blood test or imaging study, fibromyalgia requires a more nuanced approach. Doctors rely on a combination of factors. They must consider the patient's comprehensive medical history, which includes any previous diagnoses and treatments. These factors include the patient's medical history, physical examination, and a detailed account of symptoms. The physical examination helps to identify any tender points or areas of pain. Additionally, ruling out other conditions is crucial. Doctors must ensure that symptoms are not caused by other medical issues, such as rheumatoid arthritis or lupus. Previously, doctors used tender points to diagnose fibromyalgia. These are specific areas on the body that are painful when pressed, and their presence was once a key diagnostic criterion. Tender points are specific areas of the body that are painful when pressed. However, this method has evolved over time. Now, doctors use different criteria. They focus on the overall pattern of pain and other symptoms rather than just tender points. They consider the widespread nature of the pain, which must be present in multiple areas of the body for a diagnosis to be made, and the presence of other symptoms. These can include fatigue, sleep disturbances, and cognitive difficulties, often referred to as fibrofog. There are no specific laboratory tests for fibromyalgia. This means that the diagnosis is primarily clinical, based on the patient's reported symptoms and the doctor's observations. However, doctors may order blood tests to rule out other conditions. These tests help to ensure that the symptoms are not due to other underlying health issues, providing a clearer path to an accurate diagnosis. Section 6. Navigating treatment, medications, and therapy. There is no cure for fibromyalgia. However, various treatments can help manage the symptoms and improve quality of life. Treatment for fibromyalgia is typically individualized. It may involve a combination of medications and therapies. Medications commonly prescribed for fibromyalgia include pain relievers, antidepressants, and anticonvulsants. These medications can help reduce pain, improve sleep, and address mood disorders. Non-pharmacological therapies such as physical therapy, occupational therapy, and counseling can also be beneficial. Section 7. Exploring complementary approaches, alternative treatments. In addition to conventional treatments, some people with fibromyalgia find relief from complementary and alternative therapies. These therapies include acupuncture, massage therapy, yoga, and dietary changes. Acupuncture involves inserting thin needles into specific points on the body. It is thought to stimulate the body's natural healing processes. Massage therapy can help relieve muscle tension and improve circulation. Yoga and other forms of gentle exercise can improve flexibility, reduce pain, and promote relaxation. Section 8. Living well with fibromyalgia, practical tips. Living with fibromyalgia can be challenging. However, there are many things you can do to manage your symptoms and live a full and meaningful life. It is crucial to pace yourself, prioritize sleep, and engage in regular physical activity. Pacing yourself means avoiding overexertion. Break down tasks into smaller, more manageable chunks. Prioritize sleep by establishing a regular sleep schedule and creating a relaxing bedtime routine. Engage in regular physical activity, such as walking, swimming, or Tai Chi. Choose activities that you enjoy and that fit your fitness level. Section 9. A hopeful future, treatment efficacy, and ongoing research. While fibromyalgia is a chronic condition, there is hope for effective management and improved quality of life. Treatment approaches are constantly evolving. Ongoing research is shedding light on the underlying mechanisms of the disorder. By combining conventional treatments, complementary therapies, and lifestyle modifications, individuals with fibromyalgia can experience significant symptom relief. It is essential to work closely with healthcare professionals to develop an individualized treatment plan. With the right support and self-care strategies, people with fibromyalgia can lead fulfilling lives.